So welcome to the inside of the colon. I think so many people don't really understand exactly what is a colonoscopy and what are we doing when we're looking at the inside of the colon lining. So here we have this giant inflatable colon to try to make that a little bit more clear. And I'm going to take you on a tour of it. So firstly, we have normal colon tissue. The normal colon tissue that we see is pink, it's healthy, there are no abnormal growths or anything that's concerning, and this is what keeps you having those nice functioning bowel movements. The next step is going to be what's called a polyp. Polyps are very tiny precancerous growths that can be removed at the time of your colonoscopy. So what makes colon cancer so different is that it's very preventable. When we are doing a colonoscopy, at the time of the procedure, not only are we able to diagnose cancer, but we're also able to prevent it by fully removing these polyps and then not having any cancer grow in its place. Coming over here, we have what's called a malignant polyp. Now this is an early polyp that has grown to the point where it does have focuses of cancer in it. Sometimes this can be treated with colonoscopy alone, but more often than not, it will require surgery to completely treat the cancer and many times cure it. Now we're going to head over to advanced colon cancer. While advanced colon cancer isn't something that can be managed at the time of the colonoscopy, we will take biopsies and allow you to get that diagnosis as quickly as possible and then start that conversation of how do we get you treated and cured. Generally speaking, the time that you're having the colonoscopy is painless. It's easy. The prep is the worst part for sure, but for the most part, once you're done, and it just makes it so. It underscores why it's so important for you to get that screening colonoscopy and talk to your doctor if you develop any new or concerning symptoms related to your bowel function.